Some insurance companies have allowed those with mental health needs to receive telehealth services without an extra financial burden. But as Missouri prepares to reopen on May 4th, there are concerns that coverage may vanish. Our David Chazanov spoke with a woman who has used virtual visits since this crisis began. David, how does she feel about this?
Well, Heather, insurance isn't an issue for her, but this is a situation that frustrates her, considering how much virtual visits have helped her during this crisis. Even as someone who deals with anxiety, telehealth has worked out for Christina Murdaugh.
It's incredibly helpful in helping me kind of stay centered through, a pandemic.
But Burrell Behavioral Health COO Adam Andreasen says some insurance companies don't see the benefit Christina does.
They believe that it is a diminishment of care and not worthy of reimbursement.
To Christina, that couldn't be further from the truth.
In terms of the useful information and everything that I'm getting out of it, and the, ability to continue to work on the things I was working on before we transitioned, that hasn't changed. It hasn't changed at all.
Mercy St. Louis's director of behavioral health, Kyle John, says there are many health situations that can be addressed virtually with the same success rate as an in-person visit.
There's a lot of things that I need to be in my doctor's office for, but there's a certain number of things that I don't have to physically drive to the office to accomplish.
John says his team is nervous about what will be done about insurance reimbursements when states reopen.
Will the government tighten back up, or will they say our providers are giving good care and they're doing it in a manner that patients will really desire? Why get in the car and drive across town if I can accomplish the same thing on a video visit?
It's a situation Burrell is taking a stand on.
Ask that our lawmakers and ask that our payer sources really start diving in and looking at the outcomes we're seeing now, the outcomes we're going to provide, and recognize that expanded telephonic options should become the new normal.
Andreasen says some Burrell patients say they have liked telehealth visits more than in-person visits, and Dr. John with Mercy said the same thing and says it has been popular among adolescents and the elderly.
All right, we'll have to wait and see where it goes.